I've been in law enforcement 24 years, and I've seen a lot of change in how we handle these child protection cases. When I first started, our goal when we did a search warrant on a house was to find the contraband. We now look at it in a complete different way. We measure where we find the contraband. Is it in reach of where a child could reach? That's largely how we process a drug house now. And just to shed light on what a drug house is and the dangers involved there, especially with what our workers go in when they're doing home visits and follow-up visits, the dangers that exist, the people that are around these drug residences are such dangerous people. And these kids that grow up in that environment are exposed to such dysfunction that oftentimes when we hit a place with a SWAT team, it doesn't even have a shocking effect on the children. They're so used to chaos that they don't have an adverse reaction to police and SWAT gear and rifles. We had an incident a year ago up here where our hardworking social workers removed some children from a house, and it started getting tense. And so they requested a deputy, and I happened to be the sergeant who rolled up to that call. And I'm carrying a gun, and I said, "You guys came out to this house unarmed, and here I'm armed, and I'm nervous. The hair on my neck is standing up." And to paint the picture, these houses are filthy. There's sketchy people around, and it really is a heartache to see these places. So I had a long talk with our social workers, and I said, by all means, include us when you go out to these residences. We're more than happy to work with you and keep you safe. And the follow-up on that was a couple days later, the parents went back to remove their items from that house, and some guy comes out and shot up their car. You know, that's the level of violence and dysfunction that exists around these places. And I'm happy to say that gentleman is in prison now. We really do look at all these search warrants as an opportunity to improve the quality of life of these kids and to get them in the system. And I want to build on what they're forced to deal with then. When a child grows up in that environment and they get to foster care, the problem is not solved. And a large focus of my administration is the mental health aspect of dealing with our community. I would say continue to work and push and try to get us some mental health resources, because drugs and mental health and the dysfunction that all of that brings, it's all a web of dysfunction. It all correlates.